Hi, it's Mike Putman reporting for Room Now from ACR 2019. I am excited to be able to bring Dr. Berquist here. She gave an amazing talk this morning entitled Tweets and Trolls about social media, and I was hoping that she could come here to Room Now to share some of her insights. So welcome, Dr. Berquist.
Thank you.
Really excited to have her. So my first question for you, I care very much about this stuff, but I was curious to know what got you interested in this topic and instigated you doing this talk.
Yeah, the talk this morning was on social media professionalism and issues with professionalism. I've been tweeting professionally for a couple of years now, but I've always been kind of skittish that I was going to inadvertently tweet something that would damage my reputation as a physician, which is very important to me, as it is to all of us. So the ACR kind of contacted me a few months ago about giving this talk on professionalism, and I thought, okay, good, now I can look into this both for myself and to let everybody else know there's not a lot of guidance out there for people starting to do social media as a professional. So I thought, hey, this would be a great idea, and then I've collected some data on my own, and I teach the medical students about social media professionalism now too.
That's great. That's a group that definitely needs good guidance from the beginning. Yeah. I was actually impressed by how much you were able to find. I did not expect quite as much. It was a very rigorous methodology. But so, I mean, for people out there who are looking for your top 3 top tips to know what to do, what would you sort of recommend?
Yeah, so the first thing you've got to do is have a purpose for each platform you use for social media. So if you're joining Twitter and you're doing it as a professional, you need to have a purpose. I'm here to network, and I'm here to give out medical information and share medical information. And if you keep with your goals on what you're doing, or I'm going to podcast, and I'm going to podcast on this, then you really can't go wrong, and you can't say something unprofessional. My second tip is to remember to be very, very careful with protected patient health information. It is, if you're going to blog about, tweet about, do any kind of podcasting about a patient or a patient story, I recommend getting consent from them. And if it's a quick little tidbit and you don't get consent, then it's absolutely imperative that your patient not be able to identify themselves in the post. So if you change things, if you be vague about dates and times, and give as little information possible. And my third tip is to define your time limits. You can get sucked into social media and spend an awful lot of time on it. And so, we're here to enjoy life and to see patients and do good things in the world. So, it's good to pop in, give a couple anecdotes, and, talk with your colleagues and then pop out. But set a time for yourself and say, okay, this is the time I'm devoting to social media per day, so that you can't, go too far into it.
I think that's sage advice that I should also heed. So I think that's really useful, and I thought there were a lot of great tips in the talk. Just for closing, if someone isn't yet started on social media and wants to get involved, how would you recommend they engage?
Yeah, it depends on what you want to do. If you're a physician or a medical professional and you're looking to engage on social media and have medical discussion, where you want to go is Twitter. There are physician-specific platforms like Sermo out there, but most of the medical conversations going on Twitter these days. So I'd recommend joining there. You can contact me at Bolek, Bolek, Berqui, Berqui. Or another good contact out there is Paul Sufka at P. Sufka. He is someone who's very welcoming to rheumatologists and rheumatology professionals. And also know that when you start, it doesn't mean you have to tweet things or talk about things. You can look and see what other people are doing first to get your bearing.
That makes a lot of sense. Those are a lot of the same steps that I actually took myself when I started this about a year and a half ago. So thank you very much for coming on Room Now. For more information, please go to roomnow.com for everything else that we're doing at the meeting today.